What support can you expect from the medical team at Moorfields Eye Hospital?
I think the understanding to patients that we as doctors treating their condition recognise that they are human beings, that their life has been turned upside down by their condition, and that it is not good enough just to treat the proptosed eyes, the discomfort, the squint, the obvious surgical stigmata of the condition. We also have to try our level best to restore that patient's confidence and their appearance as much as possible to where it was originally.
Certainly here at Moorfields we have a lot of experience treating patients with thyroid eye disease, and we know potentially what the outcomes are of patients like this. So hopefully we'd like to reassure most patients that although you may be going through a bad period at the moment, usually within a matter of months, maybe 6 months, maybe a year, things will settle down one way or another, with or without treatment.
We're in it with the patient for as long as it takes to stabilise the active phase and then to correct any of the sort of the long-term sequelae. And it is true, I think, to say that thyroid patients do demand, or rather their condition demands, a considerably greater input and understanding and listening and explanation from the physician. And I don't just mean the eye doctor, of course, I mean the endocrinologist. So the first point is to talk to them, explain what's going on, what they can do to help themselves, and particularly cessation of smoking, very, very important. And then to tell them what your immediate plan is, and that they do or don't have sight-threatening disease, where they are on the, if you like, the curve of inflammation, have they seen the worst of it, is it possibly still ahead? And all of this sort of discussion, which has to be made very clear to the patients.
And if you're left with any problems such as double vision or a protruding eye that you want fixed, then there are ways to do that, and that tends to be surgical.
And if surgery is required?
I explain to the patient exactly what the surgery involves. I explain to them what the risks are. I go through the surgery with them. I introduce them to patients who've had it done before. I show pictures of success rates. I show pictures of patients who've not been successful and the fact that they may have to be redone more than once, and often see them twice, maybe even 3 times on a consultation before embarking on surgery once they're content with the information.
We're all here with the aim of making them better functioning, and that we will choose with them the optimum time for them to have an operation, that we wouldn't suggest it until the eyes are ready to have it, and that it is much better to be with very little double vision or without it than to have double vision in a patch. And I think most people are glad they have had it done, but we'd obviously talk that through with them before they underwent any operation.
So the most important thing is to listen to what they say, because the patient actually tells you what concerns them, and then listening to what they say, give them an honest appraisal of what you can achieve. You cannot return a patient who's had thyroid eye disease to absolutely normal function. They'll often say, I want to return to normal. You have to be honest and say, you can bring it a long way back towards normal, but it's never truly normal because the tissues are no longer the same as they were before. They often have lost some of the compliance, the flexibility. And so whilst you can make a good job structurally, strictly it's not quite normal. But I've had many a patient who's come back and said, you've given me my life back.
It is frightening, and the patient needs a lot of support, not only from the nurses, doctors, staff, but also our nurse counsellors, but also from outside agencies such as the Thyroid Eye Disease Charitable Trust, which is a patient-led group to help other patients with thyroid eye disease.